Hey everyone, this is Chad Campbell, Certified Functional Medicine Provider with Redesign U and Hope Family Care Center. And I wanted to come and bring you an update on COVID. This is going to be super hard because as most of everybody's experienced, people are already in this not important mode or over important mode with COVID. And so I hope that you stick with this and you listen, because I want to bring you the updates and the important things that you need to know. No fluff, no politics, just the facts. Because what's happening right now is people are becoming very desensitized to what's happening. So back a couple months ago, we talked about that the virus was not going to hit Arizona as hard until somewhere around June 11th. Well, we went into isolation before that. Then before June 11th, they took us out of the social isolation, and boom, it hits when they thought it was going to hit in the first place. And then we have this huge rise. My point of this is this: what's happening in New York is not necessarily happening in your area right now. What's happening in Arizona may not be happening in your area. We have people listening from Georgia and Kentucky, West Virginia, Florida, New Mexico, California, Colorado, Arizona. If I forgot you, I'm sorry. But my point is that it's different places at different times. New York is on the rise again. Okay, so that means if it's already hit your area, it may come back to your area again. There hasn't been any herd immunity. It hasn't happened. There's no numbers to show that. Okay, so what we're going to talk about is I want to talk to you about these updated things, these things that keep seeming to be changing over and over and over again over the past couple months. But I want to preface that with this. If you feel like you're not at risk, I'm a young person. I don't have any of these comorbidities. I don't have the diabetes. I don't have the heart issues. I don't have that stuff. So let me just get it now and get it over with. I understand that. I understand why you feel like that. The two things I want to bring up to this thought process are these. One is that if you decide to do that, you have to keep all those people who are at risk out of your bubble. Now, if you say that's their own problem, that speaks to you, okay? That just speaks to who you are. For those of you who say, I'm going to do that, and I'm going to protect those at risk around me, but I just want to get it. My only thing that I want to say to you is that it is showing that people are developing these long-term complications. Nobody understands it. Chronic fatigue, hair loss, blood clots, that these things are still happening even in younger people after they get this virus. So just take that into consideration, okay? That's all I'm gonna say about it. So back in the beginning, we talked about transmission and how can you get this? Do you get it through respiratory droplets? Is it aerosolized in the air? So when you walk into a room, it's still in there. Or if you remember in the beginning, we were saying it was aerosolized up to 12 hours, living on surfaces for like 48 hours. So what they've shown is that that aerosolized theory of living in the air for over 12 hours may not be so true. It may happen in areas where there's like a lot of people, real condensed area. But for the most part, it's going to be through the respiratory droplets. That's going to come into play when we talk about masks. I want to tell you what I've seen in my office. We get a lot of the COVIDs in here, and we have a lot of the testing for the COVIDs. We have a lot of that. None of our employees have tested positive. We do multiple things to protect ourselves as well as our patients from that. But the things that I've seen that have just gone through the roof is anxiety and depression. Like teenagers, young kids, teenagers, young adults. Man, people are like needing so much mental health right now because of this. Alcohol admissions have like gone way up with this virus. And what's so hard is that these parents are coming in and they're asking my opinion. What do we do? Because the parents have to go back to school, or the parents have to go back to work, but they can't leave the kids at home alone to learn. How's the kids' mental health going to be if they're isolated all day long? How's the kids' mental health going to be if they have to wear a mask and in a cubicle all day long? And then the teachers, 1/3 of the teachers are over age 50, which puts them starting to be into a different risk category as well. It's kind of like, what's the right decision? I have no idea. No idea. The only thing that I can say to that is what's happening in your area. Is it a huge outbreak? Is it a huge outbreak? If it is, it might not be a place where you want to send the kids back to school. But we have to figure out how that social interaction is going to happen with them, and how do the parents continue to make a living, versus taking the precautions when the kids do go back to school. All right, so anyways, deaths still going up. Numbers have gone up. They're like, it's okay if the numbers go up because it's hitting the younger people, but deaths aren't going up. Now the deaths are going back up, and we're starting to see that possible second wave starting to hit now. I want to say, I don't know how to say this, because so many people believe that this is a possible man-made virus versus a non-man-made virus. Is this a regular virus? And I'm not going to try to go after that. I'm just asking that both sides would just hear me out on this, okay? Because I know many people don't believe the information that they're being given. You don't believe the information that you're being told on the news. You don't believe the information on social media. You're questioning all the information, and you have the right to, because so am I, because none of it's consistent. It doesn't make sense, right? I agree with you. I agree with you. My concern is the complications that people are getting from this virus, and that's what we want to protect from. Those blood clots happening 4 or 6 weeks afterwards, and those are blood clots to the hands, to the feet, heart attacks, strokes, the tiredness, like I said, that people are still getting, the reoccurring infections and secondary bacterial infections. And now people are starting to have these symptoms with all this hair loss that they're getting. Those are the real complications with this, okay? So when we get into transmission and how do we think about school and all this kind of stuff, there's a couple things I want everybody to think about. The respiratory droplets right now is the main way that we get this virus. Okay, so that virus through respiratory droplets is going to be based off of how much of a load that you have of that virus. When we do testing, it's called a CT count on that virus. That's what we're kind of looking at, is how much of that load of that virus do you actually have. Masks. When you wear, or if you cough or you sneeze, it's said that that will travel anywhere from 6 to 10 feet in a room. Okay. If you wear a bandana around your face, if you cough or sneeze, it will travel 3.5 feet. If you wear a surgical mask, said somewhere around 8 to 12 inches. If you wear an N95, 2 to 5 inches. That's the travel distance of that. So that's why those masks are being recommended, is because if somebody has it, it will prevent the spread of those droplets to those around them. And people saying, can you get it in your eyes and then get the virus that way? Supposedly right now, any open mucous membrane, you can get that virus. It includes your eyes, includes the eyes. So with testing now we have had where I tested one person. I didn't get the results back for over 12 days. I'm hearing these 3 numbers. I'm like, I don't even know where that is. It's taken some of ours 12 days. Now this last week it's taken about 3 to 5 days, but before that, up to 12 days. It's taken a long time to get these results. So when you get the exposure or a known exposure to this virus, we don't want to test you until at least 5 days. But that virus might not start showing itself up to 14 days. So that's why the quarantine recommendation is 14 days, because you may not start shedding the virus until that 14 days. There's now these things about the questioning, the rapid testing. It's actually, I want to explain this to you, everybody, because it's what's important. When we do the testing, the most sensitive testing, which is the PCR, the nasal swab that people are getting, it can test people up to this CT count of like 45, I believe it is. But they don't believe that you're transmitting the virus unless you are less than 35. So the lower the number, the more contagious you are. The lower the number, the more you'll transmit the virus. So now they're talking about these rapid tests, which aren't so sensitive. So they don't detect the 40, 45, but they might detect the 35 and less, because those are the ones who are more contagious. And so these rapid tests might be a new thing to come, especially because of the cheapness, being like $1 or $2 to do them, and they're rapid right then, and they're going to tell you if you are contagious at that time, more transmissible of the actual virus. And the children now, instead of sticking the swab all the way up to their brain, what we're doing is just doing, it just goes right inside the nose, just the right inside that anterior part, just the opening inside of the nose, to try to not totally traumatize these poor children with what they're doing. So we're looking at that load. Antibody testing, people always still ask about that IgM, IgG. The more of the virus that you have, the more sick you are, the more likely to build the immunity. If you are asymptomatic and you get tested, you are not develop immunity, meaning you get exposed to it again, you're still gonna have to go back into quarantine. You get exposed to it again, you still may get sick, okay? So if you test positive and you're asymptomatic, that really doesn't tell you anything. If you wanted to do the antibody testing, IgM, meaning an acute infection, and an IgG, meaning you had the infection more than 3 weeks ago. The IgG will tell you if you developed immunity to it. Okay, so you can always go and ask your provider to test you for an IgG antibody 4 weeks after you think you may have had that virus. Medications, this is the big thing. You know, we've gone through hydroxychloroquine, azithromycin, these crazy doses of zinc. Goodness, I mean, there's been so many of all these things that have come out. I had one tonight. I just got done with clinic and had 2 positives having complications, and then I think 5 others that were possible cases tonight. And one of the questions is, what about this remdesivir? And with this medicine, it's for complicating patients in the ICU, not just for anybody, okay? The new one that you'll hear a lot about, the inhaled budesonide. I've been using this for a while now, and it does not necessarily help that first week of the virus, because that's just a virus. The second week is when all the lung complications happen, or when those cytokine storms may start, things like that. And so if somebody's having those lung issues, in certain people, inhaled budesonide may help. I've been using the nebulizer treatments, and I've been getting good results with that. So that might be something that you might look towards. They were talking about like Pepcid and using some of these H2 blockers, and they did a research study and showed that people who were using those, it showed absolutely no protective effect. And they even had people using the more potent ones like PPIs, which are omeprazole, Prilosec, Nexium, those kind, and it actually showed that those people, it had a negative effect on them, which makes sense because that's decreasing the acid in your gut, which decreases the immune system, which then makes you more susceptible, right? So what we want to do is to make sure to increase our immune system. And we still talk about vitamin D, still vitamin C, still with lower doses of zinc, like 15 to 30 milligrams of that. Eating right, sleeping good, decreasing the caffeine, decreasing the alcohol. Those are all the good things that you can do to help the immune system to be able to do its job, to help you through this and to help your kids through this. The big buzz here, and I know maybe you've been waiting for, vaccines. These vaccines are being rushed. They are trying to rush through this. And I really would not put high hopes in this. And here's my thought with this. In order to be able to develop a vaccine, you have to understand the virus that you're developing a vaccine for. If we understood the virus and the experts could tell us what the virus was truly about, we would be doing things a specific way. Nobody understands the virus. So I am unclear how you can develop a vaccine safely without understanding the virus. That's what I have to say about that for now, okay? So again, this thing isn't going anywhere anytime soon. This COVID is going to continue. We're going to continue to see this. We're going to continue to see these fluctuations. We're going to continue to see the rise in areas. We might see a drop in areas, but see a rise again. And how long is it going to last? I don't know, but I do know this. I am admitting people to the hospital who can't breathe. Oxygen levels are low. I have people that have throat clots. I have people whose family members have died from COVID alone because they weren't allowed in there with them. I had one tonight whose grandfather just died of COVID. Now the mother has it and they are having all the symptoms as well. Can you imagine what is going through their mind or what they're thinking about could possibly be happening with this? So again, I know I asked before, and I'm gonna ask this again. Even if you don't feel like this is serious enough for you, please think about the immunocompromised and the elderly and those people who are at risk for this. Do what you can do to protect them. Help protect them. This is our society. This is our community. These are our people. We are all in this together. And if we start getting back into these social media wars, do you wear, do you not? You're horrible because you wear, you're horrible because you don't. It's just going to make this even more chaotic. Like I told you, one of the #1 things I'm seeing right now is all this mental health stuff because of all of the anxiety and chaos because of this virus and because of us not being able to come together. So please think of the people around you. I'm asking you to, okay? I'm gonna keep trying to do some webinars. I'm gonna do an interview with my daughter, and she's 6 years old, and I would love to ask her, and I'm not gonna prep her on this, I'm gonna ask her, what do you think about this COVID and this virus? And I can't wait to show you guys, I can't wait to hear what she says, and I can't wait to show you what your children might really be thinking about this as well. So until we meet again, I appreciate your time, and if any questions, please don't hesitate. Get into those comments, go to redesignu.net, send us messages through there or comments through here, and I'd love to have the conversation with you. Thanks.